Hello, viewers. Welcome to the CSR Universe's Leaders Talk segment. The crisis of 2020 COVID-19 pandemic compelled not just our scientific community, but even our social sector stakeholders to find ways to make the vaccine and the vaccination services more accessible to the most marginalized sections of society, especially during the lockdown period where there was a lot of restrictions on movement. And it was here that Jivika Healthcare, with its Vaccine on Wheels project, a one stop mobile medical clinic, emerged as a savior and the solution to this problem of accessibility. And with its innovative sterile setup, it ensured equitable access of COVID-19 vaccine to the most vulnerable and needy sections of the society. And for its commendable work in this field, the organization won the CSR Universe Social Impact Awards 2022 in the special areas CSR category. And today we are truly grateful and privileged to have thought leader and representative of Vaccine on Wheels Jivika Healthcare, Mr. Jignesh Patel, who is the founder and the chief executive officer of Jivika Healthcare. A very warm welcome to you, sir.
Thank you so much. Very good morning to all, and it is privilege to have you have us receiving the CSR award from the renowned platform CSR Universe, who has made through a great, you can say, leaps and bounds in terms of connecting with various stakeholders within the Indian CSR network. So it is our honor, and thank you so much for giving us this opportunity.
So thank you so much for giving us this opportunity for this deliberation discussion that we're going to have today. And on behalf of my organization, we would like to congratulate the entire team of Jivika Health Care for the commendable work and the accolades and accomplishments it's been getting.
Thank you so much. Thank you.
So, sir, to begin with, can you just throw some light on this special project, Vaccine on Wheels, how the genesis of it, what factors led you to, conceptualize this idea?
I'll take you through little, you can say, history in terms of, during 2018, when I was doing my research fellowship with IIT Hyderabad, which is a one-year research fellowship program, residential program at Hyderabad campus. So we were doing various, you can say, during clinical immersions, doing observations with various healthcare ecosystem, be it you can say PHCs or CHCs or government hospitals or private hospitals.
Mhm.
One of the you can say problem which we saw that vaccination industry in terms of typically in India the hard to reach populations are huge. If we saw during that time almost more than 5 lakh you can say villages are not having immediate access to medical facilities. And when it comes to routine immunization for children, more
Mhm.
than 30% of the population are not able to avail government's free vaccination. The
Right.
vaccination is free, but
Mhm.
to avail that vaccination, you have to invest from your pocket in terms of travel time, in terms of travel cost,
Right.
in terms of you have to forego your half day or 1 day daily wages also, because we are talking about bottom of the pyramid population. So this is called cost of availing service or cost of seeking service.
Mhm.
So to avail the government's free service, they have to invest, and which is because of you can say those inconveniences. More than 30% of the Indian children were not able to get vaccinated.
Mhm.
So that was the main reason that we thought of that. Why can't a medical facility in
Mhm.
terms of mobile vaccination service can go to these hard to reach villages, hard to reach areas? Even if you talk about, you can say urban as well as urban peripheries, there are hard to reach areas. So with that, you can say considering that particular problem and pain point of Indian healthcare ecosystem, we
Mhm.
came up with Vaccine on Wheels as our first intervention, as our first venture to support the hard to reach population.
Okay, great. So, with this democratizing the access to healthcare and treatment, Can you shed some light on this particular project, Vaccine on Wheels, for which you had won the award, and the scale and impact of the same?
So we started our journey in 2019 when we incorporated Jivika Healthcare, and we started our first service as Vaccine on Wheels as our first model within the mobile medical healthcare overall as our, you can say, vision. So in 2019 we introduced our service in Pune city where we did our pilot implementation. We
Hmm.
understood that what are the bottlenecks while serving the, you can say, middle and below middle class population for vaccination need for their children.
Hmm.
So it was, you can say, well before pandemic where we were focusing on routine immunization for children. So we did implementation, we had all the understandings and we were ready for, you can say, scale up because it was supported by IIT Hyderabad and Bill and Melinda Gates Foundation. So when the pandemic hit, we started working towards how we can scale this particular model and we can, introduce more than 200 such mobile vaccination units across, you can say, couple of states across India, so
Hmm.
that when the time comes in terms of when the COVID vaccination is ready,
Hmm.
our units will be, you can say, ready to serve the bottom of the pyramid population.
Hmm.
So we were ready in terms of scale, we were ready in terms of pilot implementation. And when the COVID vaccination came, we kind of, you can say, collaborated with various CSR as well as international NGO and other donor partners to introduce more than 200 mobile vaccination units, through which we actually serve more than 2.5 million people in less than 1 year. So that was the, you can say, impact and scale at which we served the India at large and helped, you can say, overall ecosystem to get vaccinated 2.5 million people with COVID vaccination.
Okay, that's commendable. And sir, you were talking about collaboration over here. So apart from CSR, social sector stakeholders, did you also align with the local governing bodies, and did you have medical professionals on board? So how did you go about it?
So when I talk about collaboration, so if we want to, you can say, have a massive scale,
Mm-hmm.
if you want to create large impact, the collaboration and, you can say, partnership requires at the grassroots level, at the you can say at the village level, at the tehsil level, at the district level, state level,
Mm-hmm.
all government officials as well as non-governmental officials, which we call it key opinion leaders.
Mm-hmm.
And obviously CSR donor partners as well as various key strategic, you can say, partners, including, you can say, central government of, you can say, DBT, BIRAC, as well as, you can say, Gates Foundation, as well
Mm-hmm.
as, you can say, Startup India, Invest India. They
Mm-hmm.
all came forward,
Mm-hmm.
and that's how basically, it was a massive, you can say, collaborative approach through which we could, reach out to this scale and impact.
And so what about medical professionals on board? Did you have any medical professionals to guide you through?
Yes, so basically it is a doctor-based mobile vaccination clinic. That was the concept because be it routine immunization or be it, you can say, any kind of vaccination,
Mm-hmm.
there is always a chance of having adverse, uh, you can say,
After.
adverse reactions, which we call it AEFI.
Okay.
And so to tackle that AEFI situation, there has to be a medical professional
Mm-hmm.
in terms of qualified doctor
Mm-hmm.
to tackle that kind of situation. So we kind of, you can say, recruited local doctors who were available at the tehsil or block level. And at
Mm-hmm.
the same time, each unit was also having nurses also. So we created a kind of network in terms of, working closely with the DHO, that is district health officer, and tehsil health officer.
Okay.
So they were having always, you can say, manpower available in their pool,
Mm-hmm.
and it's basically a contractual manpower which they have. So when we started recruiting our people, so first and foremost, our, you can say, model was that we reach out to the DHO because ultimately we are becoming extended arm of government's district health officer and tehsil health officer. So we used to ask them in case if you have any nurses or any doctors available
Okay.
who are unemployed as of now,
Okay.
so we can recruit them. So almost 80% of our recruitment were done at the local level who were unemployed.
Oh.
And if you talk about, you can say, other impact. So
Mm,
one impact was that we administered more than 2.5 million doses in hard
mhm,
to reach areas. That's a large impact. But if we
mm,
talk about many other impacts in terms of providing employment opportunity to the unemployed, be it medical, doctor, or nurses. So
mhm.
during that time, almost you can say we recruited more than 1,000 people
Okay.
in more than 40 districts across 6 states. So 80% people chosen those who were, you can say, absolutely unemployed and looking for an opportunity. So that was kind of, you can say, secondary impact, indirect impact, which we created for the ecosystem.
That's wonderful, sir. So, sir, while implementing all these projects, and especially during the lockdown, which had thrown so many challenges to us, like there were restrictions on movement, and of course there was a lot of misinformation about the COVID-19 vaccine. There was a lot of vaccine hesitancy. So, what challenges did you face, and how did you counter those?
Very interesting question. I when you ask this question, I remember a couple of, you can say, incidences
Mhm.
which I would like to describe.
Yes, please.
So there was one village near Satara, within Satara district,
Mm-hmm.
where they were basically kind of, you can say, street hawkers who used to sell the, you can say, vegetables in the you can say, local market. So
Mm-hmm.
whenever we used to take our vehicle in terms of mobile vaccination unit, and people used to know that this is a vaccination van, and it has come for a vaccination, and people used to run away from there. You can say whatever thela kind of they used to have, they used to keep there, and they used to run away because in that particular village there was one death happened.
Oh,
That was not related to vaccination.
vaccine.
That was because of COVID.
Mm-hmm.
So the conception, or you can say the misconceptions were there that in case you are getting this vaccine, people are going to die. So we saw that example, and we had a good, you can say, problem to solve. So what our team, local team, we considered that they approached the Gram Panchayat Sarpanch of that particular village.
Mm-hmm.
We convinced, and obviously Sarpanch has the larger impact, and Sarpanch was also having, you can say, obligations to vaccinate their, you can say, villagers
Mm-hmm.
before the, you can say, COVID is infected and take more lives. So we kind of, you can say, convinced him. He got convinced, and then he took a step, a brave step, that where he kind of invited all the villagers and
Mm-hmm.
told them that in front of you, I'm going to get vaccinated with the same van which is supported by government and various, you can say, partners ecosystem. And in front of almost, you can say, 50 people, he took the jab, and then almost 30 people took the jab immediately after that kind of showcase kind of, you can say, demonstration. So that
Mm-hmm.
is one incident. So every village was having different, you can say, misconceptions, different, you can say, hesitancy kind of, you can say, because lot many factors are there within the village rural level we do not know. Similarly, you can say we used to take the advantage of key opinion leaders. So
Mm-hmm.
for example, in Tamil Nadu, there was, you can say, one you can say Muslim community who
Mm-hmm.
were little bit hesitant. So we basically again convinced the Maulvi of that particular community, and he came forward, and he basically convinced people to take the jab.
Mm-hmm.
And that was kind of, you can say, great examples where in terms of, you can say, COVID pandemic, to you can say overcome the COVID pandemic and maximize the government's COVID vaccination drive, each and every community, each and every religion people came forward as a key opinion leader and they help us as well as government to reach to the massive scale of immunization. So this kind of approaches were taken at the grassroots level to reduce the vaccine hesitancy and vaccinate by and large people.
Okay, and what about the restrictions on movement? Did it actually hamper your initiatives in any way?
No, basically, as it was, you can say emergency service, because
Hmm.
we were providing medical service in terms of vaccination, and
Hmm.
vaccination was the only, you can say, way to overcome the pandemic.
Hmm.
So everywhere we were having, you can say, access of or you can say support of local government, be it you can say district collector,
Hmm.
or you can say commissioner, or you can say district health officer, tehsil health officer, and police system and all. So because we were always working with
Hmm.
government, for people,
Hmm.
so we were never had such kind of issues.
Hmm.
And during strictest possible lockdown, our services were available, and even we are really thankful to our all the you can say workers, frontline workers, be it you can say doctor, nurses,
Hmm.
healthcare assistant, drivers, ambulances,
Hmm.
and you can say the community mobilizers, be it you can say project coordinator or program team who were doing implementation. So they
Hmm.
went all out without worrying, with the simple mission that every day we have to vaccinate at least 100 to 200 people with
Right.
one mobile unit. So
Right.
that kind of, you can say, hunger was there within the team and within the
Hmm.
ecosystem. So it was a great, you can say, example.
So, but did that, the urgency and the focus on COVID-19 vaccine particularly, did that actually obstruct the traditional focus of, the immunization program, the other programs that you have?
Yes, obviously. So even almost you can say for 1.5 year, we were also not focusing on routine immunization,
Right, right.
because the COVID, which is by and large, we have seen many lives taken during first wave. Then
Hmm.
the second wave was even bigger. So the entire health ecosystem, or
Hmm.
rather, I would say entire world, was focusing on just one problem:
Hmm.
let's eliminate, let's overcome this COVID pandemic. So during that point in time, the larger, you can say, priority
Hmm.
was COVID vaccination. So during that time, our focus was also, you can say, not there towards routine immunization.
Hmm.
And that kind of, you can say, hampered. And now we are seeing the result of, some or the other places, new, you can say, epidemic is coming in terms of, for example, recently, Mumbai, there was a measles outbreak where
Hmm.
few children had to lose their lives. So obviously somewhere down the line, over there, even the entire ecosystem where they lost focus on routine immunization,
Hmm.
so that has come. But it's you can say inevitable that you have to focus on one thing, and then you can move
Right.
on to the next thing. But the biggest part is that we as India has overcome the COVID,
Hmm.
and third wave is the great example where there was no, you can say, any bigger casualties. Numbers were very very less, and
Yes.
then we are thankful that there is no you can say further COVID waves have come.
Hmm.
And then the, you can say, simplest and greatest example is that because our larger population got vaccinated,
Yes.
almost you can say more than 2 billion doses have been administered.
That's true. That's quite a feat for us. So, when we were talking about, uh, vaccine hesitancy and misinformation, misconception, were there also any social engagement tools that you had gotten into and to mobilize the masses, these communities? So, what were the strategies that you had?
Strategy was very, very crucial, because we were operating, you can say, more than 200 mobile vaccination units in 40 districts.
Right.
And so every day, almost you can say, one unit used to visit 2 to 3 villages
Mm-hmm.
across, you can say, 6 states.
Hmm.
So we had a very good, you can say, implementation plan, followed by, you can say, leadership of Sangeeta More, who was, heading the program management across India. And Sangeeta More has more than 25 years of experience into social developmental sector in terms of implementation of any programs.
Mm-hmm.
So, under her leadership, we, had a great strategic move in terms of, we used to first sit with Tehsil Health Officer,
Okay.
District Health Officer, in terms of doing the uh, day-wise mapping of every unit. So
Mm-hmm.
every unit was given a day-wise plan that which villages they are going to visit on a particular day for
Mm-hmm.
next month, so that those villages handpicked who are hard to reach,
Mm-hmm.
where government facilities are, you can say farther, at least you can say more than 3 kilometers from the nearest government facilities, and where the immunization penetration is lower.
Mm.
So that's how it becomes the extended arm. So government there has their own, you can say, resources whom they were
Right.
focusing.
Right.
And as it was a mobile van, so government was leveraging this particular asset resource to
Mm.
reach out to the those hard to reach population. And so when we take the mobile unit at the village level,
Mm.
half problem is already solved because vaccination unit has come down to their doorstep. They don't have to travel, though they don't have to, you can say, put a leave in terms of your that you can say, daily, because they are farmers, or they are, you can say, one or the other, you can say, household kind of, you can say, business which they used to look after. So they don't have to forego all these things. And it's kind of, you can say, walking distance. They simply have to walk because it's their own village
Mm.
and get the vaccination done.
Mm.
So half battle is won. Then the next important aspect was we have to create announcement that,
Right.
on after 2 days there is a vaccination unit is going to come down to your village
Mm.
to do the vaccination for entire village.
Mm.
So to do the announcement, we had a project coordinator for every unit. He used to visit that village at least
Mm.
2 or 3 days prior to meet Asha worker, Anganwadi worker, Gram Panchayat team of that village, so that at least 4 to 5 people, key people of that village, are knowing that there is a vaccination campaign happening after 1, 2, or 3 days,
Mm.
and time is announced, and we have also given the, you can say, the place of vaccination. And then to, you can say, go next, you can say, move, we used to create a WhatsApp flyer, and we used to mention the village name and the, you can say, the place of vaccination camp
Okay.
details and time of the vaccination drive. And then we used to share it with Asha worker, Anganwadi worker, and Gram Panchayat people.
Okay.
So within that village, they used to have a small group, be it a mother's group or pregnant woman's group, or you can say the villagers group. So they
Mm.
used to forward in that. So that kind of, you can say, small things helped in terms of creating awareness and announcement.
Mm.
So people used to come in masses. So I would say vaccine hesitancy was only a 5% problem. People
Okay.
were willing to vaccinate. People were knowing that this is the
Mm.
only way for us to defeat and defeat the basically COVID and make our lives secure.
Right.
So 90-95% people were already convinced, and all we have to do is make them vaccine facility accessible
Mm.
and create awareness in terms of announcement that there is a vaccination drive is happening on so and so day. So this kind of micro management with a larger, you can say, strategic moves were
Mm.
helped in terms of vaccinating, and so we were not having, you can say, larger, you can say, challenges by and large.
That's great. That's amazing. And you found such innovative ways to actually reach out to these people and engage them also at the same time. So we talk about disposal of medical waste as a major challenge in the healthcare industry. So how environmentally responsible were these projects, especially in terms of disposal of waste?
Yes, very interesting and very important. So, as it was vaccine, and after every vaccine administration, we have to discard and we have to, handle the bio waste very carefully, because those were used and through syringes. So,
Hmm.
for every beneficiary, for every vaccine administration dose, we have
Hmm.
to have a use and through syringes. and needles. Then you can say vials, which were carrying the, you can say, vaccines.
Hmm.
So those needs to be, and then the cotton and swabs basically. So those all have a proper protocols defined by government, and biomedical waste are clearly, you can say, defined protocols.
Hmm.
So our team was also having, you can say, various, you can say, colored dustbins, be it you can say green, yellow, or red, as part of, you can say, protocols. So they used to keep the, you can say, bio waste as part of the protocol defined.
Hmm.
And at the end of day, when they reach out to the government facilities to hand over the unused vaccines, they
Hmm.
used to hand over the bio waste also to the government, and then government has their own way of getting the bio waste discarded as part of the protocols.
Okay, great. Very streamlined, in fact. So, who were your strategic and corporate partners, and what kind of support and help did you receive from them during the planning and implementation of your initiatives?
So basically, we had different, you can say, partners. Be it, you can say, if you talk about strategic partners, then couple of strategic partners we had, that is BCG, Boston Consulting Group,
Hmm.
USAID, then Give India, United Way, Samhita, Rotary Club. Within
Hmm.
Rotary Club, we used to work with various, you can say, Rotary clubs. But one of the, you can say, prime Rotary Club partner was Rotary Club of Pune Central.
Hmm.
Then we had various mentors who were having 25 plus years of experience, like you can say Mr. Ajay Dubey.
Hmm.
He was one of the great leader who worked with Narayan Murthy sir during his tenure, and he left, you can say, Infosys as a, you can say, vice president. So he was there as, you can say, our mentor, and helping us to how to streamline, how to execute. Similarly, Ravi Kapoor sir was there, having, you can say, his IITian background and more
Hmm.
than 5 years of industry experience. Plus, you can say various other, you can say, supporting, or you can say, strategic partners, like you can say COVID Action Collab.
Hmm.
Then all the, you can say, state governments and, you can say, district authorities were also part of it, in terms of our larger aspect. Then we had, you can say, various CSR donors, and
Hmm.
then the CSR donors, corporate donors, were, you can say, by and large big in numbers. Be it, you can say, ICC Foundation was there with us, Franklin Templeton, 3M, Persistent Foundation, then you can say iCertis, BMC Software, Tata Teleservices, then you can say Petrofac, HSBC, and many more partners were there in, you can say, close coordination with, you can say, various other strategic partners. So this all ecosystem came forward. One was as a donor, and one was as a strategic, you can say, partnerships. And then even government, in terms of at the, you can say, Department of Biotechnology, BIREC,
Hmm.
uh, we, you can say, had an opportunity to get the or be part of the accelerator program, which is meant for the startups. So that helped us to, you can
Hmm.
say, streamline our model to take the services at the large scale, which
Hmm.
was, again, you can say, in partnership with Gates Foundation, VentureWell, and Welcome Trust. So it was a large collaborative support which we received from the entire ecosystem,
Hmm.
which basically helped us to reach the unreached, or you can say, serve the underserved population.
Yeah, so COVID-19 actually helped us, as a community to collaborate and find solutions to this problem. And I'm sure you must have seen an influx of partners during that period.
Absolutely true.
So, currently, how are you planning to expand Vaccine on Wheels, and what are the new projects? What is the emphasis now on in the healthcare domain?
So we at Jivika Healthcare work with the, you can say, vision in terms of, with our mobile medical service
Mm-hmm.
as a theme, as a concept. We want to help healthcare ecosystem
Hmm.
to address those problems which are actually not adequately addressed by current healthcare ecosystem. So, in that perspective, we want to take our mobile medical services to the next level and be the pioneer within the healthcare ecosystem
Hmm.
to serve the underserved population with affordable, equitable, and quality healthcare
Mm-hmm.
for urban and rural population.
Mm-hmm.
So, with this particular vision in mind, we have, you can say, three different divisions. So, within Vaccine on Wheels, we have recently introduced world's first interest-free, subsidized, EMI-based, subscription-based vaccination service,
Okay.
only meant for those population who are taking vaccines from the government.
Okay.
So the 85% of the population who are taking vaccine from the government, which is huge population for India, because
Mm-hmm.
every year 25 million, that is 2.5 crore children are taking birth, out of which 85% is taking vaccination from government.
Mm-hmm.
And government has their own limitations, and it is not possible for government to provide each and every vaccination. So there are six vaccines which are currently not available as part of the, you can say, government's universal immunization program. And
Okay.
those are basically, you can say, typhoid, hepatitis A, Japanese encephalitis,
Mm-hmm.
chickenpox, meningococcal, and influenza. So this is a part of, you can say, a program which we have launched, which we call it Har Ek Tika Hai Zaruri.
Okay. It's not very clear. Yes, now I can see it.
Yeah. So we have come up with a campaign called Har Ek Tika Hai Zaruri.
Mm-hmm.
So what government is giving, that is also important.
Right.
But what government is not able to provide, that is also important.
Absolutely.
Because typhoid, we know there is a disease. Influenza, we know there is a disease.
Yes.
Meningococcal, there is a disease. Japanese encephalitis. We have we have become India's first private service provider
Mm.
who has customized vaccination service and come up with third vaccination schedule, which meant for beneficiaries of government. So we are not increasing burden of below middle class population, asking them to take all vaccines from private. So
Mm.
current private service providers provide all vaccines. So either they have to take all vaccination service, so
Mm-hmm.
which middle and upper middle class population does. And below middle class population are already taking 11 vaccine preventable disease from the government,
Mm-hmm.
and they are only left with six. So
Yeah.
we should ask them to take only those six vaccines which are not provided by government. So
Mm.
they have come up with subsidized in a way, almost 23% discount we are giving on those vaccines.
Wonderful.
And at the same time, it is, you can say, monthly installment. So every month they have to give an installment through
Mm.
which they can, avail. So we have made it affordable for the below middle class population. So that's what now you can say our you can say new initiative, and how we are taking vaccine on wheels as the, you can say, program ahead meant
Mm.
for, you can say, child vaccination.
Right. Right.
Then second is chemo at home,
Mm.
where in a currently healthcare ecosystem in tier 3, tier 4, and tier 5 towns, the cancer patients have to visit metro tier 1 and tier 2 cities to avail chemotherapies, to avail radiation therapy.
Mm.
And every patient who is basically a cancer patient have to visit more than 25 times to healthcare facility to avail and get the treatment done.
Mm.
So if you see the, you can say, number of visits are high, and at the same time the discomfort or uncomfort
Yes.
in terms of, traveling from tier 3, 4, and 5 town to some other towns, and that is true after, you can say, weekly, or you can say once in a 2 week for almost, you can say, next 10 to 15 chemo cycles.
Mm.
It's very painful.
Very tough.
It's a very inconvenient for cancer patient, because cancer patient is already in pain and he has to undergo another pain. And at the same time, if there is a cancer patient in the family, only patient is not suffering. Their relatives, or you
Right.
can say
Family.
family members, are also suffering.
Yes. True.
So to reduce this pain, we have come up with, you can say, chemo at home model, where we are going to partner with larger network of onco surgeons, onco physicians, and
Mm-hmm.
going to take chemotherapy in this towns where currently there are no chemo daycare facilities, and there won't be chemo daycare facilities, because hospital-based infrastructure based, you can say, chemo daycare facility will not be viable for these smaller towns where there is no volume.
True. True.
But asset light model like chemo at home will
Mm.
be possible to make it, you can say, viable. And at the same time, as we are asset light, we are not heavy in terms of infrastructure. We are able to reduce the overall cost for chemotherapy by 20 to 25%. So just to give you, you can say just a hint in terms of, for any cancer patient, if they want to avail chemo therapy in, you can say, private, then
Mm-hmm.
they have to spend almost, you can say, 2.5 to 5 lakh rupees for 10 to
Yes.
15 cycles.
Yes.
Within that, if we reduce the cost by 20-25%, they will have savings of almost, you can say, 1 lakh rupees, which becomes huge for middle class and even upper middle class population. So
Definitely.
that is the our next problem which we are trying to solve by taking the chemo facility in those towns where currently no facility is available. So again, we are doing same in terms of serving the underserved population. And then when we talk about, you can say, our public-private partnership in terms of within the CSR framework, we
Mm-hmm.
are, you can say, pivoting our vaccine on wheels model, or you can say mobile vaccination unit in terms of health and wellness center on wheels.
Okay.
So HWC on wheels is basically a model where we are doing 20 plus disease screening conditions.
Okay.
So it's a very holistic approach in terms of it is beyond primary care on wheels model, where we are doing the screening for 20 disease conditions within five different service categories. It means within non-communicable disease, we are doing screening for hypertension, diabetes. Within
Okay.
eye care, we are doing screening for cataract and glaucoma. Within cancer screening, we are doing screening for oral cancer, breast cancer, cervical cancer. Within, you can say, communicable disease, we are doing screening for malaria, typhoid, tuberculosis, dengue, and many others. Within pregnant woman care, as part of National Health Mission, there
Mm-hmm.
are various tests needs to be done, starting from pregnancy test to syphilis, HIV, hepatitis B, hepatitis C, urine markers in terms of glucose and protein with the help of urine based test, then including, you can say, blood group test, because in tribal populations and village level, they do not know that what is their blood group. So
Ex-
for pregnant women, this
mm,
is very important.
yes.
So it's a holistic approach where we are again becoming the extended arm for governments, PHCs, and HWCs,
Okay.
and reaching out to those villages which are at least 3 or more than 3 kilometers away from government facilities. So recently we have implemented this model in
Mm-hmm.
partnership with USAID, BCG, Japaigo, then Jharkhand state government, Give India, and you can say Rockefeller Foundation within the Jharkhand state, where we have introduced such four health and wellness center on wheels unit to serve more than, you can say, 400 villages of Jharkhand state. So far we have already, you can say, did a screening of more than 7,000 patients or beneficiaries
Wow.
for these disease conditions, where we have done disease conditions screening for more than 40,000 disease screenings for this 7,000 population. So that's how it has come. And then if any patient is having, you can say, or any beneficiary has, you can say, higher risk for a particular disease condition, needs next level of, you can say, diagnosis or treatment, then
Mm-hmm.
we refer it to the government. So that's how we become the extended arm of government and help beneficiaries get their treatment done at government facilities and while doing the early screening. So this is something what we have built over last, you can say, 1 year to, you can say, expand our, you can say, service model within the CSR network, within the, you can say, public-private partnership model.
Wow, it's a very well thought out and a very comprehensive medical support system that you're building. So, my last question to you would be, what would be your recommendations and advice to your peers, in driving such sustainable and meaningful social impacts?
I would say that, we are learning from our peers. We are learning from, you can say, the entire CSR as well as entire healthcare ecosystem. And I would say that, we are just, you can say, 3.5 year old organization.
Right.
Within the public-private partnership, we are, you can say, hardly 2 year older into the ecosystem. So it is not, wise for me to give suggestions or, you can say, give advices. But what we do, that I can say that, we pick up a problem and we work with industry experts like, you can say, BCG. or you can say MIHFW, or you can say National Health Mission, from you can say top level to grassroots level, and we find out the what are their pain points,
Hmm.
what are the pain points of you can say end consumers, or you can say end beneficiaries who are residing in a village. So we do our lot of due diligences before we come up with any you can say particular project and program.
Hmm.
And we also see that the program, or you can say problem which we are trying to solve, it has to be a scalable, it has
Hmm.
to be meant for you can say large population across India. So we
Hmm.
don't go for a particular problem, which is a problem of, or you can say, just one community or one district.
Hmm.
Rather, we look for you can say, larger problem. And we always, from day one, we start looking forward from that perspective, that how we can, make this model a scalable model.
Hmm.
How we can introduce 4 or 5 such, you can say, mobile medical units, and how we can scale it to maybe 1,000 plus or 5,000 plus, how we can scale it from we can say maybe one state to more than you can say few states, how we can have a holistic approach. So now we have even designed you can say a digital application,
Hmm.
which is you can say doing the capturing the data at the grassroots level for
Oh.
all these disease conditions, helping them to do the follow up, helping them to do the follow up checkup in the next month when we are going to the same village. And then ultimately it is getting linked with the government's Ayushman Bharat, you can say digital framework, so
Hmm.
that tomorrow if any patient who got detected with one particular disease condition
Hmm.
wants to avail the facility in government, you can say facility, then all the data will be basically is getting linked with the ABHA ID, so that it is linked with the government facility also. So whatever we do, we work in a holistic manner,
Hmm.
not just trying to solve a you can say problem for the community, but trying to solve problem for the government and for the whole ecosystem also. So that's how we work. So in case that help to our peers, that's really great.
Of course, that's very inspiring. And as I said, very, very well thought out strategy over there. And I'm sure people who are listening to you will actually incorporate, especially the CSR, the corporates, the social sector stakeholders, will incorporate all the learnings that we got from you today. Thank you so much for that very inspiring and insightful interview. And we are again very, very thankful to you who have joined us and given this opportunity to have an interaction with you.
It is really honor, and it's a privilege to be here. And thank you so much for this opportunity in terms of sharing our thoughts and taking our you can say this initiative, showcasing this initiative to entire the ecosystem. And it is even you can say great opportunity for us, and giving this opportunity from your side, that itself is a great you can say moment for us. Thank you so much for this inspiration and appreciation.
Thank you so much, sir. Thanks a lot.
Thank you so much.